Question: A 45-year-old male presents with recurrent episodes of severe unilateral periorbital pain, associated with ipsilateral lacrimation, nasal congestion, and rhinorrhea. These episodes last for approximately 15 to 180 minutes and occur multiple times throughout the day for several weeks. The pain is so severe that the patient is agitated and restless during the episodes. What is the most likely diagnosis? A. Migraine. B. Cluster headache. C. Tension headache. D. Sinus headache. The most likely diagnosis for this patient with recurrent episodes of severe unilateral periorbital pain, associated with ipsilateral lacrimation, nasal congestion, and rhinorrhea, lasting for 15 to 180 minutes and occurring multiple times throughout the day for several weeks, is B. Cluster headache. This patient's clinical presentation, characterized by severe unilateral periorbital pain, ipsilateral lacrimation, nasal congestion, and rhinorrhea, is highly indicative of cluster headaches. Here's the rationale for choosing this diagnosis. Severe unilateral periorbital pain. Cluster headaches typically present with excruciatingly severe, unilateral pain around the eye or temple, often described as sharp or piercing. The duration of the episodes, multiple times a day, lasting from 15 minutes to 3 hours, is characteristic of cluster headaches. Autonomic symptoms. The presence of ipsilateral lacrimation, nasal congestion, and rhinorrhea, along with the agitation and restlessness during the episodes, supports the diagnosis of cluster headaches. These autonomic symptoms often accompany the severe pain during a cluster headache attack. Options A, C, and D are less likely in this case. Migraine, option A, typically presents with a pulsating or throbbing headache, often associated with nausea, vomiting, and sensitivity to light and sound. While some symptoms may overlap with cluster headaches, the distinct pattern and duration of the attacks, along with the autonomic symptoms, make cluster headaches more likely in this case. Tension headache, option C, is characterized by mild to moderate bilateral head pain, often described as a band-like pressure or tightness around the head. It does not usually present with the severe, unilateral, and recurrent symptoms seen in cluster headaches. Sinus headache, option D, refers to pain caused by acute or chronic sinusitis, often presenting with facial pressure or pain that worsens with bending forward. It is not typically associated with the characteristic pattern, severity, or duration of cluster headaches. In summary, the specific pattern of severe unilateral periorbital pain with associated autonomic symptoms, occurring in clusters over several weeks, strongly suggests a diagnosis of cluster headache. Appropriate management and treatment options for cluster headaches should be considered for this patient.